Right. Here's a shoulder. A lot of times when people have shoulder problems, what they don't mean is shoulder pain here. They're saying shoulder pain here. Well, guess what? That's really probably a neck problem. So we're going to talk about shoulder pain. That's going to be outside of the scapular border and out. And what is that often going to be? We could be looking at a couple of things. One, we could be looking at this rotator cuff here being the issue, right? One muscle has to do the arm raising, the rest have to allow this to stretch out. So we could be looking at those aspects on the back side, these deeper structures on the front side. We could be looking at this nerve bundle that comes from your neck, travels under your collarbone, goes under your pec. We could have nerve entrapment in here that's pulling on your shoulder, causing problems. As you can see, the bicep here has multiple attachment points. And if there's a problem in the bicep, it can cause problems at the attachment, thus feeling like shoulder pain. We could have stuff like a nerve entrapment on the front of your rotator cuff, and then when you try to stretch it out, shoulder pain. You could have an instability issue where these structures like the serratus anterior muscle are grabbing onto some of these nerves down here, or even instability into the abs. Any of those can cause shoulder problems. If you are dealing with a provider or providers that don't understand how these things interplay with each other and how to assess which one's the dysfunctional one and how to prioritize these problems, you're probably not going to get the results you're looking for. This is our bread and butter. Figuring out the problem, prioritizing your issues, and then starting at your number one worst problem and working our way down and watching the symptoms unravel and thus get less frequent, less intense until you are pain-free. This is what we specialize in. So if you have a shoulder problem, this sounds like you, reach out.